I'm just wondering, from your perspective as an MD, the indications for lymph drainage are so vast. How am I going to present that to somebody who, my uncle who's a cardiac surgeon, and I say, I learned this. I know I'm going to get pushback.
You tell your uncle, this is a book, it's 500 pages. You have 50 pages of medical reference. It's written by an MD and DO. So first of all, if you are in the PT world, it's very well received because it's reimbursed by insurance. It's one of the most documented alternative or manual therapy because you can see the rhythm of lymph, put a dye into it and see the progression of the lymph, see the change, it's related to immune system, inflammation. It's really easy to explain. The craniosacral, unfortunately, we don't have enough proof yet. The acupuncture system, we try. It's not really clear. Nobody agree on how it works. The fascia therapy, yeah. With the lymphatics, you have the most documented manual therapy. So for PTs, yeah, it's great. It's recognized and reimbursed by insurance and everything for lymphedema and for other cases. But one day I proposed a study. I work a month to submit to work on the astronaut. And I submit something to NASA because they want to go to Mars. And when you are an astronaut, because you have no gravity is the equivalent of -6 degrees. So all the blood going to your head, nothing in your legs. This is no gravity. We like to have a lot of blood in your legs and less in the head, but then you feel like this. So, if you stay like this for 3 months going to Mars, it's horrible because you have blurry mind, you don't think so clearly, your nose drip, and you have, osteoporosis and all kind of things happening because all the fluid are like this. Is very uncomfortable. So I say, why don't you make them drain themselves, 1, 2, 3 times a day? And we show them how to drain, and the astronaut can go in space. And maybe after 3 months, if they regularly drain, they're going to feel much better. They like, or the way they think, they like to work with pills or things like that, rather than manual therapy. Manual therapy is not technology, you know what I mean? And they like technology if you can. Draining myself, I don't want to learn and feel myself. I want to put a machine that just do this on my neck, and they don't honor it so well. So you always have this trouble that, it's manual therapy, even though it is one of the most recognized scientific modality out there, is still going to be a little bit alternative, or is never as good as a pill, or one day you modify a gene to help lymphedema, so that's a problem. But that's why I wrote such a boring book, because it's really conservative. I try to be very medical for the insurance, the PT, the MDs. And here it is. Boom, you have all this chapter. And as an MD, I knew 0.1% of my book in med school. In med school, I learned where the nodes are. I never saw the entire, like you saw the entire pathways of lymph beautifully all over the body. I never saw that. I learned where the nodes are. They get swollen, what the cause of a swollen node is called adenopathy when you have a swollen node. And I learned the immune system. So the macrophage, the mastocyte, neutrophil, eosinophil, basophil, but that's it. I didn't never learn lymphedema, anything like you learn. It's new for the MDs. They don't know so many things. They don't know, for example, there's a lymphangion discovered in 1961 that pumped the lymph. 90% of the MDs and DOs think the lymph is totally passive. You have to squeeze it with your hand like a toothpaste and deep breathing, and that's all you can do for the lymph. And maybe trampoline, but you don't know how much it helps. There is a cardiac surgeon, I think it's Dr. Lemot, that talk about how, it's very interesting for cardiac. Actually, there's a little chapter in my book. The idea is they think a lot about myocardial infarctus as caused by a bacteria, like, the ulcer created by a bacteria, Helicobacter pylori. So they think maybe one day we'll find also a bug for a lot of heart attack. The bug creating some inflammation, thickening the arteries, the coronary arteries, creating some plaque. So, or you don't forget the bug, you say inflammation, plaque, and then you close your coronaries. What drain plaque? What drains fat in the body? If you go back, what drain plaque and fat? What get rid of inflammation? And even one more step, what get rid of bacteria? All that job is made by the lymphatics. Dogs have very rarely heart attack because they have a much more extensive network of lymphatics in the wall of the heart. And because of that, they have much less heart attack. When they clip the lymphatics of a rat or a dog in lab, they have a galloping atherosclerosis. In 2 weeks, they have blocked and have the heart attack. So lymphostatic cardiomyopathy, a cardiac problem caused by a static lymph system. Ask him if there's any news about lymphostatic cardiomyopathy. He's going to say, what? What a word. Now, why do you block your lymphatics? Well, Maybe if you are type A and you work like crazy all the time and you don't make your emotion flow, lymphostatic cardiomyopathy. If you are stuck in your emotion, if you are stuck in your brain, you have a very limited way of looking at things, it's going to slow down your lymphatics. That's going to bring some bug here. That's going to create inflammation, and that's going to create plaque. It was an interesting and logical explanation for some of the heart attack. How many heart attacks do we still have? Maybe he's going to say, oh, it's only 2%. Maybe say, oh, wow, that's 30%. Maybe he's going to say, maybe 70% of the heart attack come from stagnation of the lymph system. And you are coming here and you say, well, you know what? I know how to activate the lymphatics of the heart. You learn that probably in level 2 and 3, but I know how to work a little bit more than lymphatics, because even by now, working on the neck and the axilla, which is going to basically globally drain the area, you can already help. That's a way to work on him. And it's totally scientific. It's not woo-woo at all. The fact that you can move your lymph with your hand, say, well, I never heard that your lymph can help. Says, no, look, you can increase a certain amount, and is used by the PTs and for lymphedema. So it's a fact of science that we can move the lymph. We work on edema and lymphedema. Wow. So you could do it on your heart. Yeah, you can do it on the heart of many patients to prevent heart attack regularly. That's just one way to think at it in a very, very high level scientific way. And it will be like, wow. And you're going to talk to him like you say, lymphocytic cardiomyopathy. That's what you learn in your seminar. Wow, I want to come next time. Look in my book. I think I talked about that in a chapter at the end when we all the different specialties.
437. It is next to the dog.
Next to the dog.